So now we're going to turn our attention to the secondary line. Okay, the secondary is much smaller and has a hook with it. And if you don't happen to have the hook, there's usually plenty laying around. Now again, don't open from this end. There's no perforation there. It's a nice, easy tear open right there. So I'm going to pull this out. It'll be important for the primary bag to be lower. So I'm going to go ahead and hang that on a hook. So this is called a secondary or a piggyback. Again, I'm going to clamp it here. Okay, I don't want any fluid to flow through this. So I want you to think about it. You have this very tiny bag. So secondary infusions or piggybacks are usually a volume of 50 milliliters, 100 milliliters, 250, okay? If I prime my line with this, which is always going to be a drug, then I've lost drug, okay? So now my patient's not going to get the dose that they should get. So don't do that. We're going to back prime, okay? So I'm going to pull my spike here. Got to give it a little muscle. And in order to get the spike in, I'm going to give it a little bit of a twist and push. There. Now there's no reason for me to do anything with the drip chamber yet, okay? Now, I just hung this primary IV line. So I happen to know that this is sterile. If this had been hanging and I was putting up the secondary infusion brand new, I would want to clean this or want to make sure that I was taking a disinfection cap off. But I know I just hung this, so this is all good. It's all sterile. So what I'm going to do is pop my cap here, attach it here, and it just screws on. Now, I'm not going to hang my bag upside down to do this back prime, and you'll see people do that, but then the chamber never gets any fluid in it, and the bag just gets really full. It really doesn't make great sense. So back priming means that I'm going to take fluid from the primary bag and put it into the tubing for the secondary, okay? So the fluid is going to flow from this primary bag through here, and then instead of going down, it's going to go through here where I just attached the tubing, and it's going to go down this line, and then I'm going to stop when I get into the chamber with this fluid. Okay? That makes sure that I don't lose any medication. So now I'm going to release this clamp, and you're going to watch the fluid flow from here and into this drip chamber. Okay? So I've got my roller clamp, and you'll see it just kind of start, and then I can do this as quickly or as slowly as I want. And if for some reason your bag doesn't want to infuse, you can either lower this or raise this, because again, it's gravity. So when I raise the bag, do you see it? So it flows right into here. So the fluid's right here right now, okay? I'm going to lower the bag again. See? There's your fluid. Now I'm going to go ahead and finish that off. And now I'm ready. Okay, so that's back priming. Now I can hang my medication up. And then again, I'm going to tell this pump what medication I just hung. I'm going to tell it how fast I want this to run. And then before I leave, I'm going to unclamp this. And then I'm going to make sure that I have a drip in this chamber from this bag, meaning that it's actually infusing. Now, the pump's going to beep at me in a few minutes when this little bag is done. And I really want to come back and clamp this back off. Of course, make sure that once you've gotten through all this technical piece, that the IV is actually attached to your patient and infusing. So that's it. That's how you hang a primary and a secondary line, and that's really all there is to it.